This is a video on how to do a neonatal dressing change. To start, clean all work surfaces with purple wipes. Next, make sure to have all of your supplies ready. This will include 2 sets of sterile gloves, one for each participating RN, a secondary dressing, and your neonatal PICC dressing change kit. This kit will include the following items. Pause to read. Once your work surface is prepped, you can start to open all of your supplies. Start by opening your sterile kit. Don clean gloves to open the rest of your packages. Two items will be present to grab with your clean gloves. The first is a packet of hand sanitizer, which will be used before donning sterile gloves. The second will be 2 extra masks. Anyone present in the room during the dressing change must wear one. Continue to open your kit. Once fully open, you can drop any extra supplies needed sterilely. 3 people are preferred for a NEOPICC dressing change. 1 as the holder of the patient, 2 the RN performing the dressing change, and 3 the RN who is sterile. Using clean gloves, place the sterile drape under the PICC site or limb to use as a sterile field. Start removing the old dressing using detach-all. Be gentle and precise when removing the dressing. Watch for any tension or pulling on the line throughout the process. Removing the old dressing may take a while. Be patient and have the holder attempt to console the patient if they are upset and moving. The second RN should be donning sterile gloves while the primary RN is removing the dressing. Once the hub is exposed, a sterile finger should be placed to prevent movement. Continue removing the rest of the dressing. Once fully removed, the primary RN should use the provided alcohol packet and don sterile gloves. Open CHG swabs and hold them in your hand while discarding the silver package. Clean insertion site and surrounding skin with CHG using a back and forth motion for a minimum of 30 seconds. For femoral lines, the minimum is 2 minutes. Make sure CHG is completely dry before moving on to the next steps. Always roll your finger off the insertion site. This prevents the line from accidentally sticking to the glove and getting pulled. Apply skin prep to the area. Then Mastisol. Once tacky, carefully coil the external catheter. Visualize the catheter and compare the external tubing length to the PICC or midline card at bedside or EPIC flow sheets to ensure there have been no changes. If there is a noted change, contact the MD after dressing change has been completed. Apply a transparent dressing over the looped catheter. Hub or wings must be beneath the dressing. Using the scissors provided, cut the pieces of the dressing to the size of the patient. This piece is called a chevron piece. This helps maintain a good seal. Place another piece across to complete the occlusive seal. Time and date your dressing per policy. You may use Mastisol around the edges at the end of the dressing change. This can help with ensuring it's occlusive and help maintain its integrity.